Oh, this is an emergency. We
Really?
have to get rid of this. Absolutely. You can't be on vacation with
No.
those. So when you're walking on the beach, they think you're Versace? What's her name?
Donatella.
Donatella. Do they think you're Donatella?
I don't know. Lately, I've been hearing Meg Ryan, and I just hope it was before she had her work
Oh,
done.
please. When I was in general surgery, I rarely got thank yous. You'd say, you'd be in trauma, the emergency room, you take care of someone, someone came in with, a ruptured appendix, you never got a thank you. The first breast, when I went into plastic surgery, you do a breast reduction on someone, and they say, or a facelift, they go, oh my God, Dr. Skolnick, I love you. You walk on water. I mean, it's just amazing. You save someone's life, and they don't even feel that way. So it's been very rewarding as far as that's concerned.
Yeah, I mean, I love the interaction with my patients. In my practice, it's really patients you're talking about. Do you become friends with your patients on Facebook? I mean, so many of my patients, we feel like we're friends.
My mother's a pediatrician, and she always gave shots to little kids, and so she insisted that I be as good as her with her injections. So hopefully this.
Well, that's good.
So what do you do when you have a patient who sits in front of you and you just don't like them for the first interaction? I had a senior surgeon once tell me, Elon, the biggest thing I can tell you, the one pearl of advice is when you sit down in an initial consultation and you talk to someone, they tell you what their problems are, and you don't like them. Don't operate on them.
The biggest problem is if you get seduced by the idea that this patient is paying for your services.
What I like to do, especially people who kind of new to this, is to keep it conservative, because you can always add more.
Yes.
But if you put too much, you can't suck it out. And not only that, it costs more, and you may be unhappy. So you can always come back in a week or two. We can put a little bit more in.
Okay.
I'd rather do it that way. And most people are pretty happy with that.
What's going on here? What can we do here?
You're smiling too much. You gotta stop smiling so much.
I know. I can't do that.
Yeah.
No, I'm done there. No, you don't need it. Do you have like special Botox that looks better?
Thank you. Yeah, we got special Botox.
Competition is so great in our field because so many people who are not really trained to do what we do want a part of the action.
You also have a lot of other physicians who are encroaching on our specialty who are non-surgeons.
Oh.
Family practice doctors, GYN doctors, dermatologists.
Dentists.
And the senior surgeons
Dentists.
like
Dentists,
you
there's a new one.
didn't put up enough of a fight. And so the junior guys like me have to
Richard.
suffer. You guys didn't put up a wall saying you can't do this, you can't do that.
Oh, good,
and now you're getting ready
The problem
to
is
go off into the sunset.
It's not yet.
I mean, my background is very
Oh, my God.
international.
Absolutely.
Patients are coming from all over, and just as much patients are like, oh, I'll go have my surgery done in South America or Thailand or India.
Right.
I mean, I had a patient who came in who was like, Dr. Hallis, I really love you. I really respect you. Ivy League. Oh, that's so great. He goes, anybody that you know who could do the surgery for a quarter of the price in Argentina?
So how did you get into plastic surgery?
And I was always a fix-it kind of girl, and surgery combined everything. And facial plastics was a combination of happy patients. We have medicine, we have non-surgical treatments, we have surgical treatments, and then on top of that, I was an art history major, so it was all perfect. Perfect package, a perfect combination.
Yeah, I've always had droopy. I took after my father.
How we address the upper eyelids is we make a little incision that runs right here in the crease. We do extend it out so it gets rid of a little bit of that crow's feet.
Okay.
And we remove that excess skin and fat that's weighing down on the lid. So let me just show you some these are some lower lids and some upper lids. Let me make it so that you can see better.
I always knew I wanted to be a surgeon. I mean, I love working with my hands. I mean, from the get-go, I knew I was going to be a surgeon. But I like the aesthetics associated with plastic surgery. It's not going to be this. You're not going to be pulled. Your mouth is not going to be distorted at all. But a nice, fresh, comfortable look. Okay?
So if I could spend the rest of my life flat on my back,
Yes.
I wouldn't need the surgery.
Absolutely. If you were a hooker, it would be perfect. Okay. And you, Alon? How did you end up?
I used to have a lot of daddy long legs in the spiders in the driveway, and I used to pull their legs off and watch the little body jump around.
Okay, let's move away from that right now.
So my father said, "Hey, you should be a surgeon." Oh, it's bad.
It's bad, right?
Yeah,
It's bad.
Well, it's bad. I gotta pay the rent. Do it again. Okay, up. Okay, good. All right, and a frown, like you're mad, like you're screaming at the kids. Oh, you're good at that.
Right? There's
Yeah,
that.
yeah,
There's
yeah,
that in the
yeah,
middle.
yeah,
That's
yeah.
new. That's
Yeah,
motherhood
that's
for you.
fine. There you go. You're good at that. All right. Okay, and away we go. Little pinches.
The second that someone finds out that I'm a facial plastic surgeon, they go, "Oh my God, I'm so embarrassed. Were you looking at me seeing what I needed to have done?"
I get that every day.
And you know, initially when I meet somebody, I don't. You know, I'm looking, I'm talking to them. The second they say that question, I have to keep my eyes looking straight into their eyes because I will look either at the wrinkle or the nose or the lip or
If I'm in the subway, if I'm walking on the street, I'm at dinner, the first thing I do is say, "Oh God,
You're
that
not
person."
scanning the
What I
crowd.
could. Oh,
I wish
boy.
they were
This is
general
an
anesthesia
You're
right now.
continuously scanning the
This is
crowd.
amazing.
The only time I do that is on the
Quick,
subway.
someone give them some propofol. Yeah.
Absolutely.
Yeah.
This is an emergency.
No. The only time I do that, you don't do. You can't do that all. I do not do that all the time.
I was at this resort and I was sitting at a table of 8 people. What do you do? What do you do? What do you do? And they came to me. I said, I'm a plastic surgeon. Well, 6 of the people, which was obvious to me at the table, had their nose done. As soon as I said I'm a plastic surgeon, all 6 of them went like this. I really need to decompress on the weekends. For me, you know, I take so much home with me. I always worry about this. If I operate on the patient, what's going on?
I'm still worried all weekend, but it's nice to see my children.
So exactly. So I go up and I just you know kick back, and it's just so much easier. And pour a drink, have a glass of wine, have some
Yeah, but
friends
there's nothing to
over.
do up there. What do you do like at 2
I just
p.m.?
said that.
What's
Kick
going
the-
on at 2 p.m. in the
At
country
2
home?
p.m. I'm
Yeah.
at Sam's Club.
What's Sam's Club?
Sam's Club.
Oh, the Costco.
Costco.
Yeah,
Yeah.
come on now. Shopping. You know, I'm Jewish. You shop. Okay, and then you eat. Those are the 2
That's what
things
you
that
do?
That's what you do. You know, you shoot.
I will shoot. You don't shoot guns up there?
No, I don't shoot guns.
You know, and ditto for me, except you know we have kids, so. Except I went to Paris. So,
For the weekend?
For the weekend.
So what did you do then?
What
You
did we
ate?
do? We ate.
You drank?
We ate, we drank, and of course the art history. I mean, I had to hit the museum, so it was absolutely fantastic. It was a great time. So tell me what you shot and killed this weekend, because
I didn't.
I know you're bored by our lives. So
I didn't. No, I actually didn't go shooting this weekend, but I did. So I'm starting a practice. So on Friday night, I tweeted a little bit because that's like the new thing, right?
Is
You
that a
tweet
sex
kind
thing?
of thing? No, I mean like professional stuff.
Oh,
You
I
tweet
see.
once
you
a day.
tweet professionally?
I tweet professionally.
Yeah. And I'm a friend of his on Facebook, so I
He's a
open up
friend of you,
Facebook
right.
and
You
I
see
see
my
I think
tweets?
you
and I
friended
see
me.
his tweets all the time.
You know, like,
yes, I see. Numbness is normal.
Numbness is normal.
I
That
don't
was
know
one of
if
my
that's-
tweets.
I don't know
right?
if it's after sex.
Right.
Numbness is normal. After surgery.
No,
numbness
it's
is
very
normal.
specifically said after liposuction.
Oh, after
there are
liposuction.
prescriptions that can help with that, by the way. It's not my specialty, but
Right.
What, after
Psychiatrist
sex
will
or
refer
after
you.
liposuction?
well, actually, I don't do body and
I
after
see.
sex, so I would say that sex isn't my
Well,
specialty.
please.
But the treatment of Elon's issues might be a little.
Oh, okay. Aren't
So,
those
yeah,
different
so-
drugs?
I feel like gang.
No. We love you a lot.